I'm Joe Chile. You can join me mornings on the Big Weck. Joining us on the Big Weck Buffalo on the Rise today is Dr. Hassan Dasluolu. Nice to have you here today.
Thank you very much.
Thanks for joining us. And the doctors from the VA of Western New York, the VA healthcare system. Tell us why we have such a great healthcare system here in Western New York.
The VA system is particularly good. First of all, it's one of the busiest in the VAs in the region in terms of New York and New Jersey, and we provide the highest volume of surgical care. I'm just going to talk about in general surgery, as I'm the chief of surgery. The main philosophy of the VA system, which is a little different than the private sector, is that it's really based on the benefit of the veteran. The focus is the veteran. So nobody else but the veteran benefits from being treated in the VA system, meaning it's not because of the procedures that the doctor does or somebody else does will have any profit from that or anything else. It's only based on the veteran, and this is really based on their how they're going to benefit most, with irrespective of the cost of the treatment. So it's really a focus that you don't have to go through some insurance coverages or any of that. So all you do is what is the best for this veteran. And I have been in the VA system for 22 years now, and I'm a vascular surgeon. I've been the chief of surgery for the last 12 years. And I have never had an instant where we thought that was a technology or something that was that the surgeon thought was good for the veteran, and that anybody actually had any issues or we had to go through any loops to get that. So the focus is the veteran, and that's the philosophy that you can't find anywhere else.
So it's not a situation like, if I was going to look for a doctor, I'd have to look for a specialist. Then make sure the specialist was, within the group that, that I could get paid for, things like this. The veterans group has all that encompassed in one group, right?
Well, yes, and also we make sure the system is designed in such a way that if the system doesn't have that best person for the veteran's needs, then it actually makes it very easy to actually send the person out to the best person who's going to be treating that person. So it's with the design is also for the timely care of the veteran care. So, for example, if the veteran, let's say there's a Mission Act that was designed for that if a veteran lives far away or cannot get timely access to the care in the VA system, then they're actually allowed to go out and seek care in the outside. However, it turns out that a lot of times the VA system actually can provide the care much faster, even for those who are living far away. So they actually elect to seek us. But that design are also for the benefit of the veteran, in the sense that if we think that they're going to benefit more from being transferred out, because not every hospital has every specialty.
Oh, sure.
So we actually will individually send people to those in a very efficient way.
So when you talk about the Western New York healthcare system, the VA healthcare system, what area does that encompass? Is it just the Western New York area? Is it the 8 counties? What area does it encompass?
The Western New York covers Buffalo, obviously, and then Batavia. We have our satellite, buildings in outside, but it's really Western New York in that area. Rochester has its own region, but we do get a lot of referrals from Rochester because they don't have surgery provided there. So we would get those kind of patients. Although they would qualify to go locally, a lot of them will elect to come to us just because we will be providing more timely care. I'm talking more about surgery again. But the primary care is excellent in the VA system. So it's so efficient that they would be contacting us in a very efficient way with no wasted time. And sometimes it's not rare that a veteran who elects to stay locally and outside will actually realize that we will be getting faster care and a good care much better. So much earlier and a better care. It has happened many times.
You talk about you've got a 5-star rating. What does this mean?
So the 5-star rating is interesting. The Medicare services look for a lot of qualities, and they assess the quality of a hospital. So the first time they included the VA hospitals in their star rating this year. So outside of about over 4,500 hospitals in the United States, about only 10% of them actually qualified for the 5-star rating. And Buffalo VA is the only one in Western New York, and only 11 hospitals in New York State qualified for the 5-star rating. So, and in terms of, it's about the mortality, the readmission rates. So it's all about the quality of care that the Medicare objectively looks and reviews, and it's a very objective assessment of quality of care provided. So we are very proud as the only one in Western New York of all hospitals who got the 5-star rating, and one of the 11 in the New York State.
We've only got about a minute and a half left in our segment. Maybe you can talk about some new surgical procedures or techniques.
Well, we provide I'm a vascular surgeon, so I'm going to pitch in that one first. So we provide the most comprehensive and complex vascular care in Western New York, period. And then we also have excellent surgeons, urology, surgical oncology. We have been providing robotic surgery by our urologists, general surgeons, and gynecologists for over 10 years now. So we provide all the state-of-the-art care in our facility, and in a timely fashion. So we are really proud to take care of our veterans. And one last thing I'd like to say is the veterans who get treated by us can attest to that, is that once they are in the VA, they will be treated with respect that they deserve, having served our country. So, and they feel that very much. So, so we are proud to be a part of that service back.
Well, Doctor, you seem very thorough, and it seems that you're very proud of what the VA does. So we thank you for joining us.
Thank you very much for having us.
For more information and answers to your questions, contact VA Western New York Healthcare System by calling 716-862-8829. or you can go to www.buffalo.va.gov.
Sponsorship and promotional consideration for the preceding segment was provided by the following: